Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull all the way down. Let's talk now about a topic that is quite popular, and that is tongue and lip tie. Many of you have heard, I'm sure, read about, known of, or actually had it done yourself or to your children. Tongue and lip revisions. It's a very hot topic these days, particularly in the lactation world, because it does interfere with a lot of the baby's ability to latch on to the breast and suck adequately without discomfort, without fatigue. So, if any of you have watched the previous segment where we talked about torticollis, I would refer you back to that segment. But if there is any kind of a twist in the craniosacral system, which we know is the membranes of the head as well as a continuation of that through the membrane sac holding the spinal cord all the way down to the tailbone. So if there are any twists associated along the spine, in the neck, that are connected with the head, it's going to negatively impact baby's development in terms of their ability to latch onto the breast, suck, breathe, swallow in rhythm. Now, that being said, this is such a hot topic because so many are doing the revisions. Primarily their dentist, once in a while a pediatrician, sometimes lactation consultants, or people with that sort of a specialty background. But I'd like to refer you to some research. And as you can see, this research indicates that only about 5% of babies have an actual tongue tie, a true tongue tie. So, why are they doing so many revisions if there's such a small percentage that have a true tongue tie? You know, you'll hear talk about, by the way, this stack of papers. This is all the research that references and backs up to support that statement, okay? You hear a lot of talk about anterior tongue tie, posterior tongue tie. So one of the things that we learn in craniosacral therapy in our level 2 curriculum is all the attachments of the soft tissue under the tongue. We learn a lot of anatomy about that. For some of you, like myself, who are already specialized in pediatrics, you may have been working with this for years. You might be a physical therapist who's been working with this sort of thing for years, coming from the perspective of primarily torticollis. So there's more to the story. In craniosacral, in level 2, we learn the anatomy, and we learn it very specifically. We talk about a bone that sits like a horseshoe just above the thyroid. It has 20 little muscles, 10 on either side, that go all the way down to our shoulder blade, come all the way up the back of the neck, come up underneath the tongue, and even up to the soft palate. We learn how to release that soft tissue restriction. Okay? So let's take a look, just a little bit, at that anatomy. For some of you, this will be a big review. So, as we look at that, remember that the tongue is a muscle, just like any other muscle in the body. Okay? That tongue gives us the ability, when a baby is sucking, to actually come in to a scooping position and actually be able to milk the nipple. Okay? So that baby's tongue comes out, it forms a little valley, and it does that in conjunction with those beautiful chubby little cheeks that babies have. That fatty cheek gives them the ability to create a suction that then allows the milk to go back to the back of the tongue and be able to swallow adequately without choking. It's a necessary part. So, we in craniosacral therapy are able anatomically to go in the mouth and be able to work with that baby to release those restrictions from the inside out. Let's take another look at anatomy here. If we turn the page, for those of you that may have had some craniosacral already, this photograph should look pretty familiar. And verbiage down below begins to talk about the suprahyoids, the infrahyoids, the retrohyoids. Hyoid, once again, being that little horseshoe bone with the 20 little muscles connected to it. So, so important in terms of tongue and lip tie and releasing from the inside out. So, if only 5% have a true tongue tie, how do we know? And why are so many babies being diagnosed? I'd like to refer you to an assessment tool that is recognized internationally. Now, we hear a lot about, well, that baby has a heart-shaped tongue. So, because of that, they have a tongue tie. Or, that baby has difficulty sticking their tongue out. Okay? Or, that baby has difficulty, they do very slow, tedious nursing. It takes them a long time to eat. If we look at this assessment, we see that there are a number of parameters, and this assessment requires some training in order to actually be able to do it. But we don't just look at one factor. We look at multiple factors. So many times, babies are getting a little bit overdiagnosed. In the world of craniosacral therapy, that is our belief. Because when we talk about a tongue tie and we talk about the lateral attachment, so is it a posterior tongue tie versus an anterior tongue tie? As I showed you, there's a fair amount of research here that says a true tongue tie doesn't involve lateral connections. Those don't need to be cut. They just need to be softened and relaxed. And craniosacral therapy is one of the ways to do them. If I can refer you to a picture of what a true tongue tie might look like. We look at this little baby and we say, oh, there's that little heart-shaped tongue, so that must mean this is a lip tie. Well, actually, the ventral part of the attachment is exactly where it should be. It's not so posterior. So that's not a true tongue tie coming from the perspective of craniosacral therapy. That's a baby that needs all of that soft tissue worked on. This baby, however, if you can see that picture, that is a true tongue tie. And you see that the attachment is at a very different place. That baby is struggling much more. That baby, in fact, does need a tongue revision. But the question then becomes, does it need to have a dramatic surgery with the laser, or can it simply be a quick little scissor clip? From the world of craniosacral therapy, we would say, let's try the little clip first, because that creates a very small pencil dot wound and it heals very quickly. And it's not the kind of thing that mom has to follow through with swiping and keeping it from growing back and disturbing the healing process as you do when the tongue is lasered. So once again, coming back to craniosacral, if we can address it from all the tensions in the full body and all of the tension in the neck and the tongue, the palate, then likely we're going to be able to have a baby that nurses much more functionally. And even if baby has had a revision, it isn't necessary to stop there. In fact, it's much better if we do craniosacral, because we know from the world of cranial osteopathy, now known as craniosacral therapy, that it's a full body issue. It's not just the tongue, and it's not just the lips. And speaking of the lips, now let's talk about LipTie. You'll hear a lot about that as well. Well, once again, if we focus on the research, and there once again is a lot of it. There's a lot of articles, there's a lot of clean scientific research out there that says as baby is forming in utero, and we go from being a notochord to a brain and spinal cord, the enfolding, sometimes there's extra tissue that develops. It keeps us from having a cleft palate. So some people who have the space between their front teeth, it's been blamed from a lip tie. Not necessarily so. It has to do with more with in utero development. Well, what do you do when you have that big space between the teeth? Orthodontia is the number one thing used, or the individual says, I don't really care. The point being that that part isn't going to interfere with nursing. What interferes is a lip that the buccinator muscle that goes around gives us the ability to pucker, right? That, if it's too tight here, needs to be softened and released. If we clip it, it isn't really necessary. With craniosacral therapy, we can soften it from the inside out. Now, there may be some of you who are occupational therapists, maybe even physical therapists, maybe speech therapists, who know and have learned techniques to stretch out the upper lip, soften and relax the muscles. Again, when we come back to craniosacral, it is a light touch, manual manipulation. Light touch. It doesn't take a lot of heavy pressure, and it's very non-invasive. And from the world of craniosacral therapy, we want to be non-invasive. Now, I want to refer you to one last thing, and this is what's called a finger feeder. At least that's what I call it. Some of you may be familiar with that. Maybe a lactation consultant has worked with you using that. But for us, working with babies in the mouth, it can be extremely helpful because not only can we release the tissue, but we can get babies sucking on our finger to have an instant gratification of having some of mom's milk at the same time. Okay, so basically what's done, the picture looks like this. So craniosacral therapist has finger in the mouth, working on baby's soft tissue in a very non-aggressive way, a very light touch, and at the same time, as baby is sucking, or you can do just a very gentle, encourage the flow of the milk to get it started, it gives us a perfect scenario to be able to do mouth work and give baby nutrition and satisfaction at the same time. I hope that you'll give thought to this notion and consider it before doing any revisions. And if you have a child or know of a child who's had a revision, you might want to refer them for a craniosacral therapy evaluation just to make sure that there's no residual of soft tissue strain pattern anywhere else in the body as a result of the development of what their revision was for.